Hi, Assalamualaikum. My name is Fatina Amani binti Nur Hasbi.
Hi, my name is Lateral binti Sarisab.
We're going to explain and demonstrate about barium enema, right and left lateral decubitus.
Okay, barium enema, lateral decubitus are best projection to demonstrate polyps in our colon and also to look at if any obstruction in our colon. And it is also the best procedure to look at intraperitoneal gas.
So for cassette, we use 1417 cassette and range. We have to put the table so that the patient gets it comfortably. And then prepare a cassette, which is 1417. Make sure that it's positioned correctly so that it won't move. And we also have to put grid because it's high exposure on top of the cassette. Okay, so for the clinical factors, we choose large intestine barium enema, and then we choose EP right lateral decubitus.
For patient preparation, before the examination, 7 days before the procedure, do not take any iron tablets, but you can continue other medications. While 4 days before procedure, stop taking any constipation agents like loperamide and also codeine phosphate. Loperamide is a synthetic drug of phosphate class which inhibits peristalsis, while codeine phosphate is a type of medicine, mild painkiller and also has antidiarrheal action. 1 day before procedure, do not eat any solid food. Only eat a clear liquid diet and you need to take a laxative the night before the examination. On the day of procedure, fasting at least 6 hours prior to examination and continue to take fluids until 2 hours before the procedure. During the examination, the technologist will verify your identification and also exam requested. Technologist also will recheck your LMP and check for contrast media allergic and ask you to change into hospital gown and also remove all metallic objects. You will have opportunity to ask questions to the technologist. After that, the technologist will position you on the exam table and give instruction. In certain situations, the radiologist may introduce air along with the barium solution. The technologist will insert a lubricate tip into rectum. Liquid barium will flow into the rectum. The radiographer or radiologist will ask you to turn from side to side. If you feel uncomfortable, you should tell the technologist or radiologist. Miss Nur Nabila, what is your full name, Miss?
My full name is Nur Nabila bint Abusman.
When is your first day of your last period?
I'm currently in my period.
Are you fasting right now, Miss?
Yes, I am.
Okay, Miss, I want you to change into hospital gown with opening at the back and remove all metallic objects, especially on your abdomen area. Before the procedure, we need to give the patient shielding to protect the radiosensitive tissue outside region of interest, and in this procedure, I'm giving patient thyroid shield.
For contrast media injection, these are the materials that we should prepare. A barium enema bag that includes the catheter tip, barium sulfate around 700 gram, castographene in cases in which the use of barium sulfate is contraindicated, few pairs of hemostats, blue bulb for air insertion, white square cuff layer used to inflate the balloon of enema tip, and several packets of lubricant for the enema tip. Prepare a blanket for the patient. We will need a pair of gloves, the enema tube or bag that we prepared, and also paper towels. Firstly, we take the enema bag and close the clamp. Then we fill it with 500 to 1000 milliliters of warm water, as cold water causes intestinal cramping. And then we hang it on the IV pole. Before the contrast insertion, we should always wash our hands and wear our gloves. Then we have to cover the patient with a blanket so that the patient don't get cold or feel overexposed. We also have to make sure that there is a waterproof pad underneath the patient. And then, using the lubricant, we lubricate the tip of the enema tip. Insert the tip around 3 to 4 inches, all the while making sure there is nothing is causing extreme discomfort or pain. Once the enema has been fully administered, clamp the tube and get a paper towel. Slowly pull out the tube and wrap it to dispose it alongside our gloves. And then we ask the patient to hold the enema for about 5 to 15 minutes.
Now, I'm going to do right lateral decubitus position. After the injection of contrast into patient body, ask patient to lie in lateral position with a pillow for the head and lying on the right side on a radiolucent pad. Ask patient to place arms up with knee flex. After that, make sure that the cassette and grid placed behind the patient's back for an AP projection. Position patient or IR so that iliac crest is placed to center of IR and CR. Ensure there is no rotation occurs. Superimpose shoulders and hips from above. Give patient blanket if patient feel cold. And for marker position, I'm put left side of marker without flip.
And then we have to invade the tube. Make sure the distance is 100. The center should be at the iliac crest, and then we have to ensure that the diaphragm is visible to the symphysis of pubis, and the lateral margin should be visible here. Okay, now breathe in, exhale, hold. Okay.
For image evaluation of right lateral decubitus, it is used to demonstrate polyps of the left side or air-filled portions of the large intestine. The anatomy demonstrated is entire large intestine is demonstrated to include air-filled left curvature and descending colon. For positioning, no rotation and proper collimation is applied. For exposure, appropriate technique is used to visualize the borders of the entire large intestine and also including barium-filled portions. Mucosal patterns of air-filled colon should be clearly visible, and also sharp structural margins indicate no motion.
Now, I will explain about left lateral decubitus. So, the anatomy demonstrated in left lateral decubitus should include the entire large intestine, but it focuses more on the lateral side of ascending colon and the medial side of descending colon. The patient would be positioned in recumbent lateral with their back or abdomen in contact with grid, and the body elevated on radiolucent support to center of mid-sagittal plane to midline of grid. The IRs should be centered to the level of iliac crest. Left lateral decubitus is preferred as any free interperitoneal gas will be contrasted by the liver. And the image attached is an image of left lateral decubitus with appearance of numerous small polyps in the descending colon.
For the aftercare, you will be able to use the toilet to expel additional barium and air, drink plenty of fluids and eat foods that contains a lot of fiber. You may have white stools for a few days. Barium may cause constipation, and you need to check with doctor if unable to have bowel movement or pass gas more than 2 days after the examination.